All right, so I want to talk just a little bit about the delegation PowerPoint that you're going to look at. Also, you have the faculty version of the critical thinking and management, and it's got a little bit of information about delegation. We are just introducing you to the topic of delegation at this point. You're going to be getting in depth into the concept in your second year, but we think it'll be helpful with answering a lot of questions as you're moving forward when you're doing practice questions, because there are a lot of questions about delegation. So along the lines of delegation, we're thinking about critical thinking. And I like to show this little video clip because I think it helps people think about what is critical thinking. And we're also going to talk about the concept clinical judgment. So we're going to watch this little clip here.
Whoa, that's not good.
Oh, I don't need this. I'm already late.
Somebody will come. Anybody out there?
Do you have a phone?
No. Sorry. Somebody! Hello? There are two people stuck on an escalator and we need help. Now, would somebody please do something? Help! I don't believe this. You gotta be kidding me.
I'm gonna cry.
Well, there's not enough left to do, is it?
Hello? Hey, don't worry about it. I'll fix it in a second.
He said he could fix it. All right. All right. That's more like it. Who says he can fix it?
All right, so it's kind of just a cute video that shows what happens when people don't critically think through a situation. And a big part of our job as nurses is critically thinking. When you hear the term clinical judgment, we're going to be talking about what you're doing. So it's beyond what you're critically thinking, but what are you actually going to do? So I just wanted to flip through the PowerPoint that you have available, and I recommend you just download it on your computer, save it. You don't have to memorize this entire PowerPoint and everything possible about delegation, but we want you to start thinking about it. And I wanted to throw this first question up just for you guys to think about. And if you were paying attention to what just happened, I scrolled through the answer already. But an RN on a busy surgical unit is behind schedule administering medications. Which of the RN's other tasks can safely be delegated to the UAP? So we'll talk about a UAP in a minute. That's an unlicensed assistive personnel. So somebody who does not have a license, like our certified nursing assistants, our patient care techs, anyone who's unlicensed. They don't have a scope of practice without their license. So of these tasks, can they assess a patient who just came to the unit? Can they teach a patient who has a new disease? Can they document intake and output on a flow chart? Can they help a patient who recently had surgery out of bed for the very first time? Okay, so think about those for a minute. And I know you guys are gonna read through this a little slower than what I'm gonna do, but I'm just gonna scroll to, let me find my right slide that I like. All right, so I wanna just scroll to something that you'll read through in more depth, but the scope of practice of the RN, so registered nurse. And I want you to read this because this kind of helps you make these decisions when you're answering these questions. It's activities requiring assessment, monitoring, planning, diagnosing, evaluating, judgment, problem solving. So it is the nursing process, but not just implementation. And it includes implementation, but some of the interventions we do can be delegated to other people, or other people are able to do them. So think about some interventions that you do. If you have a patient who has altered nutrition, less than body requirements, and your goal is for them to eat, 75% of each meal for over the next week, one of your interventions is going to possibly be sit with the patient and assist them with feeding. Well, that doesn't require a registered nurse, right? That could be our unlicensed assistive personnel. So there are things that happen in the implementation or intervention part of the nursing process that other people can do. But the assessment piece is a registered nurse piece. And the rest of it. Sorry, I'm distracted. Could you go away? Riley, go away. So I just wanted to highlight that. I think that's a really important concept. And bear with me while I scroll down to, you guys will have fun here. This is the worst video ever. Okay, this slide talks about unlicensed assistive personnel and some activities that are appropriate. And I like the statement right here. Giving tasks that do not involve judgment, critical thinking, involve predictable results. So if they're doing a task for us, we're pretty sure things are going to go well. If there's a chance that something could go wrong, the registered nurse needs to do it. So if we go to, and I'm sorry, I'm jumping through all this. The next slide talks about some things that our unlicensed assistive personnel can do. They're very predictable, results. And we can delegate these things to our unlicensed assistive personnel. With additional training, a lot of facilities have trained their unlicensed assistive personnel. Some of you guys are techs and you do this stuff. You use a glucometer, which checks the blood sugar. You draw blood. You hook up EKGs. Overall, those are relatively predictable procedures with very little risk. So with special training, our unlicensed assistive personnel can do those things. I am not going to read all this stuff to you. I have a couple of slides on what LPNs can and can't do. I'll go to the can't, because people don't often know this, and your slide's not going to have this click to add title. Perform patient assessments. Now, those of you who are LPNs are like, wait a minute, I go and I assess my patients every day. Yes, but the technical legal thing that LPN is doing is observing. There's the difference. So if the LPN observes a problem, they're supposed to report it to the RN, and the RN has to come and do an official assessment. That is the legal piece of it. Again, I don't want you to try to memorize all these things at this point. It's a lot of information, and it's really all about the legal part of nursing and our scope of practice. But back to our original question, and I'm just going to flip right to the answer. So of these things, I just want to review why it wouldn't be the other three answers. So for the RN to delegate some task to the unlicensed assistive personnel, the thing that is the most predictable is the documentation of intake and output. They can do that. They can go and observe and measure the urine and document how much fluid the patient has taken in. They can put that in the chart. Nothing's going to go wrong with that. The first one, A, assessment, well, that's part of the nursing process that falls under our scope of practice. Teaching, when you read further through the delegation, teaching is something that falls under the nursing scope of practice. Now, an LPN can reteach something. So if the nurse has already gone in, the registered nurse has already gone in and taught a procedure, the other staff can reteach it. But the initial teaching has to be done by the registered nurse. And then the last one, helping a patient who's recently undergone surgery get out of bed for the first time. Next semester, when you take care of surgical patients, you'll realize that that's a really unpredictable period of time for the patient. who's had surgery. So we don't know what their blood pressure is going to do when they go from lying to sitting to standing. They've had some blood loss and fluid, problems and shifting during surgery. So they could potentially pass out on us. So that's an unpredictable situation. So the registered nurse needs to be the one getting them up for the very first time. All right. Again, there's a lot of information here. I recommend you just download this PowerPoint and hang on to it and use it as a guide to help you in your future semesters and forever. All right, that's all I got on this for now.